He tested negative for COVID-19, but Congressman Michael San Nicolas on Facebook says he has viral pneumonia and is voluntarily isolated in the government isolation facility at the Bayview Hotel. Quote, while still negative, we don't want to take any chances among the public with these symptoms. Although the government isolation facility is for patients who test positive for COVID-19 and whose home is not suitable for isolation, according to Governor Lou Leon Guerrero's chief policy advisor, Carlo Branch, quote, you can have a negative test, but if chest films show viral pneumonia and oxygen level is low, you'll be diagnosed as a clinical COVID-19 patient. Branch suggests, however, that proper protocols may not have been followed for the congressman to be admitted into the isolation facility. Quote, it is my understanding that upon verbally communicating to the congressman's sister-in-law that he may be a clinical positive for COVID, his sister-in-law, who is also a nurse at the isolation facility, endorsed his request for admission, and he was admitted without a known positive test or documents to prove it. That was from Carlo Branch. That's what he told KUAM. KUAM is waiting for a response from public health on this possible breach in protocols. But we are going live now where we do have Congressman San Nicolas in our Zoom room. Congressman, can you hear me?
Yeah, I can hear
you. Are you still at the Bayview? It doesn't appear that you are.
I wasn't even at the Bayview for 4 hours when doctors admitted me into GMH. You know, this Carlo Branch is just revealing the consistent politics of him and Underwood and Lou and everybody else who will throw doctors and nurses and sick people under the bus just to try and carve out whatever political message they can to try and win elections and take power and do whatever it is that they want to do with money and just leave people behind. And, you know, my COVID diagnosis is still uncertain, but I'm very clearly unwell. They're trying to figure out the COVID diagnosis situation. But, you know, my doctor, Dr. Nguyen, who's Lou's COVID chief, was the one who told me I needed to be in isolation and monitored. And the only place where you get isolation and monitoring that doesn't take up a bed in the hospital was the isolation facility. And so I made the choice to try and be in the isolation facility so I'm not inundating this hospital. And when I was there, the doctors said, you know what, your situation, regardless of whether the test has been conclusive, your situation needs to be in the hospital. So I'm here now. So, you know, I don't understand when's enough with these people. When's enough with these people?
Congressman, I mean,
do you have an answer for that, Bree? When's enough with these people?
I can't even tell you.
In the hospital with the monitors about to go off. When is this going to stop?
Yeah, and that's why I felt it was important that we reach out to you, because these are pretty serious allegations about you reaching out to your sister-in-law and allegedly bypassing protocols for admission.
Nothing was bypassed. I called somebody who is responsible for admissions into ISO. And when I explained to her that my doctor, Dr. Nguyen, the COVID chief, said that I have clinical COVID, she made the right call. And she said, you know what, you can't be out in the public and you need to be monitored. And so the National Guard was dispatched to pick me up. I was transported back in their secured transport. I went in. I was given my forms that I needed to sign, and it wasn't by her. I didn't even see her when I arrived. I saw 3 different isolation staff, and I filled out the necessary paperwork, and I properly went into isolation the way my doctor required of me. And so what, because there's an election, I can't listen to my doctor, I can't call for help, I can't be seen by medical professionals? Is it wrong now that I'm in GMH? Can Carlo Branch call in and say it's wrong that I'm in GMH? Because I didn't get here under the proper protocol? What's wrong with these people? Can somebody on Guam answer what's wrong with these people?
So you didn't call your
policy advisor, and his policy is to throw doctors and nurses under the bus and sick people all the way into their graves. And that policy advisor needs to resign if he's a representative of this administration.
So, Congressman, you deny these allegations that you called your sister-in-law to get in the ISOFAC then?
I didn't call my sister-in-law, Chris. I called a medical professional who works in the isolation unit, and she's my sister-in-law. But she didn't break any rules, Chris.
So you did call your sister-in-law. I mean, obviously, I feel all that's kind of moot. I mean, you're sitting here in the hospital. Obviously, you're sick. So could you walk us?
Maybe we should look into whether I'm related to anybody here at GMH and find out if they did something wrong, or we can make it look like they did. And me sitting in a bed of monitors is something that's not supposed to be happening.
Can you tell us a little bit about the?
You know, when I went to high school, I went to FD, and that's in the village of Mangilao, and AMC is in the village of Mangilao, and Dr. Nguyen clinic is in Mangilao, and maybe there's something wrong with me being here because I went to school in Mangilao. The hell's wrong with you people?
Is there anything else, Congressman San Nicolas, that you'd like to say?
No. Okay.
Evidently not.
Congressman, was there? No.
No.
Oh, no, he hung up.
Yeah.
Oh. All right. So that was Congressman Michael San Nicolas. He did go to the isolation facility. His doctor advised him to go to the government isolation facility. He said he filled out the paperwork, but not even 4 hours. He was admitted over at the Guam Memorial Hospital, and so our prayers are with him, and we
the
hope
phones
that
here. Carlo, of course, the policy director for Adelup. And can you kind of go over the statement we got last night, please?
Sure. I was asked by other media, and I believe Crystal was asked by QAM regarding the circumstances relative to the entry of Delegate San Nicolas to the secure isolation facility, as he declared on his Facebook page. So based on that disclosure, I guess media had certain questions about how a non-known positive entered a secure COVID positive isolation facility. And based on the information we were able to gather at the time, it appeared that the congressman verbalized to a nurse at the isolation facility, who also happens to be his sister-in-law, that his doctor believed him to be a COVID clinical positive, which means you do not have enough viral load to trip a test, but you allegedly meet the criteria for clinical diagnosis of COVID. So based on that, the nurse or sister-in-law apparently said, yes, you can enter, and the endorsement was signed by her, apparently, or at least permitted by her, and he was allowed to enter, which became known to the public as a result of his Facebook post.
Yeah, I don't know if you got to see the brief interview of the congressman that we just had, but he basically called you out and said, oh, this is politics, Carlo Branch, Robert Underwood. They just don't know when to stop. When is it going to be enough with
when
these
is
people?
enough? And he also called for your resignation.
It wouldn't be the first time Congressman San Nicolas has called for somebody's resignation, so I'm probably in decent company. The one thing I would say is we were asked a factual question, and we gave a factual answer. There was no politics involved in it, though I can understand that a few days before the election, everything is colored with politics. But I think you and I can both recall prior circumstances in which other individuals garnered entry into a government facility, allegedly for quarantine or isolation, and they were called to bear before the public as to why that happened, and we were called to bear before the public as to how we permitted that to happen. So I don't think that this is anything different or political. And with all due respect to my friend Congressman San Nicolas, I hope he gets better, but this has nothing to do with politics.
Yeah.
The only reason we're even aware of the situation was because he decided to put it on Facebook.
Okay, Carlo, we did ask the congressman. Well, I did ask him anyway. So, did you call your sister-in-law? And he said no. He called a healthcare professional who was his sister-in-law.
sounds like lipstick with a pig on it. Still happens to be a pig. And just in case for those people who want to take that metaphor out of context, what I mean is simply, obviously, it just happens to be a fact, and I don't know why he would be defensive about it, except that he acknowledges that may present a conflict. And, you know, that is my personal speculation. Obviously, anytime an isolation unit or the protocols by which you enter are violated or placed in a gray area, there's a review that occurs, and I'm sure that review is occurring now. But the reality of the situation is, whether for personal disclosure, fun, entertainment, or political reasons, the congressman volunteered this information to Facebook. Media asked questions, as did the public. We answered them to the best of our ability. I'm sorry that the facts paint him in an unfortunate light.
What do you make, though, of the argument that, oh, well, now he's sitting in the hospital, so all of this is kind of moot because obviously he is ill, whether it's with COVID or not?
I appreciate that he's ill, and the one thing, and people can view this as glib or not, but I've known Mike since I was a freshman in high school. We were at one time very, very close friends all the way through college. And the reality is, if he has pneumonia, viral or not, he's a vulnerable person. And so if he was illegitimately exposed to a COVID facility and got COVID as a result of that, the reality is that he placed himself in danger by being a vulnerable person and exposing him to COVID, and that should not have occurred. So regardless of my political differences with Congressman San Nicolas and whatever he might think of my personal opinion of him, I want him to be healthy and safe.
Sure.
And that is not the case if you have pneumonia and find yourself in a facility filled with a virus that preys on sick people.
Right, but Carlo, what is your response, though, that, you know, he didn't bypass or any of the protocols, that he was in fact sick, that his doctor said he had viral pneumonia, his doctor being the governor's chairperson of the physician's advisory group. When he got there, he did fill out all the paperwork.
So what I know to be true at this moment is that when the congressman presented, he did so verbally to his sister-in-law with the argument that his doctor believed him to be a clinical positive, but that he came to the facility with no documents indicating a positive test or no documents indicating from a physician, whoever it might be, that he was a clinical positive. And even in the case where a physician might believe you to be a clinical positive, that is not the sole discretion of the physician, whomever that might be. That is a public health determination because that is a public health facility. And so that determination should have been made by those in the public health regime so that, A, the sanctity of the isolation unit could have been protected, and so that, B, Congressman San Nicolas does not place himself in any undue harm, and so that, C, his sister-in-law would not have been subject to questions later about the legitimacy of her action.
Yeah. Well, Carlo, anything in closing? Because, I mean, the congressman levied some, well, kind of par for the course, but levied some serious accusations. How would you respond to his saying that when is enough with these people, I believe is what he said?
Congressman San Nicolas has always had a talent for the theatrical. And so I'll give him a break because obviously he's down with something, and regardless of our political differences, I want him to be safe and healthy. That said, you know, if he hadn't volunteered, if he had not made a show of it on Facebook, people like you wouldn't have asked the questions, and I wouldn't be here today. So it's kind of like digging the ditch and then wondering why you're stuck in it.
Okay, Carlo.
Thanks, Carlo.
All right, thank you.
Take it
Okay,
easy.
stay safe.
Appreciate it. Right on. We're going to take a little break here, and that was the Adelup Policy Director, Carlo Branch. Obviously, when the Congressman's Facebook video dropped last night, we did ask questions. I mean, he posted that he wasn't diagnosed with the COVID, but he was in the ISOFAC, and we all know the protocols for gaining entry into the ISOFAC. So, of course, we're going to ask the questions, and that was the response we had got from Carlo. We had the congressman on briefly this morning. He's hospitalized at GMH. Yes, I mean, obviously he's ill enough to be hospitalized. So that being said, we're all praying for him to get better. But that doesn't mean we don't ask the questions. And so we brought Carlo on to respond to the response that the congressman gave, and we're going to get Congressman Underwood on, former Congressman Underwood on, to do the same thing. Good morning, Congressman.
Good morning, Chris. Good morning to you and Sabrina, and thank you very much for this opportunity. And
Right.
And first of all, I just want Narissa and I pray every day, and we pray for particularly victims of COVID-19 here in Guam. And we just want to we said a prayer for the quick recovery of Mike San Nicolas this morning.
Right. Were you able to catch his brief interview on the link this morning, Robert?
No, I did not, and so I'm not sure about what he said. I only heard the chatter that the interview came to an abrupt end.
Yeah. So, Bree, if you want to kind of go over what the congressman had said.
In a nutshell, he was saying, when is enough enough? Politicking with respect to him. You know, he is sick. He's at GMH. He called for the resignation of Carlo Branch. He mentioned your name. And so, yeah, it's called it politics, basically. Making an issue of him being at the ISOFAC facility and now at the Guam Memorial Hospital.
Well, of course, you know, I haven't even talked to Carlo Branch in maybe 3 or 4 months. So this is totally, to use a term that was used last week, totally a fabrication. You know, but in any event, that's not really the issue. The issue is not about whether Delegate San Nicolas should have been in the facility or shouldn't be in the facility. He is ill, and we wish him well, and we hope for a speedy recovery. The issue is what is in front of the people of Guam. And the issue really is that we have a choice. And we have a choice between leadership, which is honest and has integrity and is willing to put themselves in front of the people in a live forum, in a debate. I've been calling for debates now for several weeks. None is going to happen. And instead of engaging in a debate, we just hear sniping on the side. And that's unfortunate. But in any event, I'm ready to debate. I'm ready to debate via Zoom. There's a forum coming up this evening on Megamix. And I've agreed to be on that forum, I think as Senator Castro has as well. Yeah. And so the issues are broader. Delegate San Nicolas is going to recover. This controversy, so-called controversy, is going to recede into memory. But what is in front of the people of Guam is enduring. How do you want your representative to behave? And which representative, which candidate has a plan for moving forward? That's why this issue, this election is so important. So yeah. While I certainly wish him well, I don't wish him ill. This is not about politics. This is about the people's future. And so the implication, always the implication that there's some kind of collusion going on is just absolute nonsense.
You know, Robert, how difficult or challenging was it? I mean, you're running against Will Castro, you're running against Mike San Nicolas, right? But a lot of your campaign has been talking about the ethics investigation, talking about the congressman's voting record, but he's refused to engage really on any of these. You know, and many would say they're very relevant issues to this election. So how's it kind of been in their shadow boxing in your campaign? I mean, this is the most engagement you've got out of the congressman. It was him calling you out from his hospital bed.
I don't look at it as shadow boxing. I look at it as truth telling. We've told the truth, and I think it's going to have an impact on the voters. And that's really what that's about. It's sort of ironic, you know, when I started off this campaign, I'm 72 years of age. And I got comments from a lot of people, you're too old, why don't you go rest up, take a nap, go to the ranch, do something that old people do. And as it turns out, I'm the healthiest guy running for Congress.
Easy
So
there, don't jinx it.
I'm not. I just say that as a sidebar.
Yeah.
Because but in an ironic
Hi,
way,
Dave.
here I am, a 72-year-old man calling for debates, alive and well, and doing okay, and I'm more energized than I was at the beginning of the campaign. And you know, it really still is. And I just respectfully ask the media, and I also respectfully ask the public, that this is really not about the individual delegate, but it is in terms of the kind of representation you want in Washington. We've unveiled a very comprehensive plan. I've talked about my record in Congress from the past. I've talked about my record as president. I'm not shadowboxing. I'm telling people what I know to be true and what I can back up with facts.
Thank you, Robert, for coming on. Appreciate you coming on quickly to respond to the words that the congressman had thrown at you. So appreciate it.
Thank you. Have
All
a
right.
great day.
You too.
Stay well.
So what's your
Stay
secret?
safe.
You take vitamins, or is it what? You down a gallon of Lodigo every morning?
My
or-
secret is I pray and I eat regularly.
Okay, let me try that. I got to eat
But
regularly.
I'll admit to one thing. In fact, let me admit to this. I have a pain in the neck on occasion, and I go to the chiropractor. And so I'm going to the chiropractor this morning, but I'm not going to put it on Facebook. Thank you very much.
Thank you,
Thanks.
Robert.